Hi everyone, welcome back to my YouTube channel. Today we are going to talk about frontal bone, and here at the side you can see the diagrammatic representation of skull, and the colored part is frontal bone. So let's start our topic with introduction. The frontal bone is a major cranial bone that forms the forehead and the upper part of orbital cavities. It's part of neurocranium and plays a vital role in both structural integrity and protection of brain. Location and articulation of frontal bone. Frontal bone is situated at the front of skull, as you can see here in the diagram. It articulates with several other bones. They include parietal bone at the coronal suture. It articulates with the nasal bone at the nasofrontal suture. It articulates with the maxillary bone laterally. It articulates with the sphenoid bone posteriorly, and zygomatic bone at lateral margins of orbit. Now let's talk about structural features of frontal bone. Frontal bone consists of two main parts. First is vertical portion, that is also called as squamous part. This is the part that forms the forehead. It has key features like frontal eminence, that is rounded elevation on either side of midline. It has superciliary arches, that are arched ridges above the eyes, and glabella, that is smooth area between the superciliary arches. Second portion of frontal bone is horizontal portion, that is also called as orbital part. This forms the roof of orbital cavity. That is notable feature include orbital plate, there are thin bony plates forming the ceiling of orbits, and ethmoidal notch, that is a U-shaped gap between the orbital plates for articulation with the ethmoid bone. Now let's talk about internal surface anatomy of the frontal bone. On the internal surface of frontal bone lies frontal crest, that is a median ridge for the attachment of phalanx cerebri. Sagittal sulcus is also there, that is groove that houses the superior sagittal sinus. Then there is impression for cerebral gyri, that are indentations that are caused by underlying frontal lobes. Now let's talk about development of the frontal bone. Frontal bones originate from two ossification centers which fuse in early childhood. Initially they divide into left and right halves. They typically join by age 8 at the metopic suture, that is a line that occasionally persists into the adulthood. Functions of frontal bone. Frontal bone plays several crucial roles. First, it protects the brain as it shields the frontal lobe of cerebrum. Second, it forms part of orbit as it contributes to the orbital cavity housing the eye. Third, it supports facial muscle as it serves an attachment site for various soft tissues. Fourth, it shapes the face and influences the contour of the forehead and upper face. Clinical significance. First clinical significance is fracture of frontal bone that often results from blunt trauma and may affect brain structure. Second significance is persistent metopic suture that can be mistaken for skull fracture in radiographs. Third is frontal sinus infection that can cause pain and complication if they extend to adjacent structures. And this was all about frontal bone. Hopefully you liked the video. If you do, don't forget to like, share, subscribe and comment. Thank you for watching.